من این دفعه یوتیوب رو بستم. Okay, let's start. Ramesh, I'm gonna put you on mute.
Oh, I'm sorry.
No, that's okay. I did that. And I'm gonna share. Why we have 4 participants? Where is the other one? iPhone 2. Oh, maybe because I did hide non-show. Oh yeah, okay. Now I can see. Okay, let me share my presentation and we can start. Okay. And I should not forget to record it. I did it last time. Good. Share again. Okay, can you see my, can you see it okay? Can you see my presentation? Yeah, okay, you know what? I have to put it here because I need to see your reactions. Okay, hello everyone and welcome to our third session of Trying Together webinar series. Today we're going to talk about a hormone and focus. So a little bit about me. My name is Azadeh Kushan. I'm a holistic nutritionist, a wife, and a mom at the same time. My focus is in holistic health. I do have coaching and consulting with my clients in the area of digestions, hormone health, weight loss, and also another focus is I work with neurodiverse families who are dealing with neurodivergent, either kids or adults, and we work together through elevating the lifestyle with the nutrition, and we go through some functional testings and lifestyle changes and things like that. We're gonna have so today we are 2 speakers. It's me that I'm gonna talk about hormone with you guys, neurotransmitter, gut health, gut microbiome, and our amazing guest speaker, Azadeh. Again, we are 2 Azadehs today, and she's gonna talk about focus and the techniques, some of the lifestyle hacks and tricks that you can apply for yourself and your kids. So I want to introduce this series a little bit to you guys. If you're not, if you haven't attended the previous sessions, this is, we started the series because we wanted to introduce ourselves to our audience, to our clients, and putting ourselves out. We are working with hormone health and neurodiverse families. So if you are a lady in your perimenopause age, late 30s, 40s through menopause, you are in the right place. If you are dealing with the neurodiversity in your family or yourself, you are in the right place. So what we started since the very first session, we said because you are as a mom are the center of this beautiful family that you have, you need to have yourself, you get yourself in balance first, then to be able to help others. You know, you have to be able to put your oxygen mask first. That's why we started with neurodiversity and a definition, and then after we dive into the hormone, and because you are in that area of your life, we want to bring the focus how you can get yourself balanced through these challenges that you are facing. I'm not going to go, this is the flow of today. We have 2 sessions of 1 hour, 12 to 1, which is a hormone talk, microbiome focus. We have 5 to 10 minutes break, and then we continue the focus talk and the hormone and neurotransmitter. Okay, let's dive in. So let me know if this is resonate with you. Are you guys someone who is finding yourself in a roller coaster of emotions? You know, you're feeling okay, and then all of a sudden, you know, you're irritated. You are exhausted for no reason, and you know you're waking up in the middle of the night, can't get back to sleep. And maybe, you know, all of a sudden, although you're eating healthy, you're doing the exercise, your blood sugar is high, and your doctor is telling you you're pre-diabetic. And, you know, you're frustrated. You want to kill your husband sometimes when you're in your cycle, or, you know, you want to get divorced. So let me know if this is kind of the person you are. Even you thumbs up, put your video on and let me know if that's resonate with you. If that's the case, you are in the right place. This is the webinar for you. This is the talk for you, and I just want to bring you, see that baby, beautiful baby and mom. Some of us that choose to have our kids later in our life, we are going from childbirth to perimenopause directly. And that is something that we miss in terms of the symptoms and all those challenges that comes with it, because we have our babies around 35, 36. That's my case. And then boom, after that, two baby and at the age of 37, 38, perimenopause starts and the signs and symptoms. And I still think this is the postpartum, but it's actually connected. So just imagine that mix of hormonal imbalances that you're dealing with. Okay, I like to talk about the GI tract and microbiome a little bit, and then to let you know what is the effect of the GI on microbiome and what is the effect of microbiome on GI tract. Sorry, and the hormones. The hormone comes to this mix. So GI tract, what is the GI tract? A gastrointestinal tract. Just imagine a straw, a tube that starts from your mouth and goes all the way down. You know where it goes. So that straw has just one layer of cells, one lining thickness, and it's responsible for for your kind of just okay. Imagine it this way. I like the metaphor that Dr. Kerry Jones using it. That straw is like a fence. Imagine you have a fence around your house. You want that fence to be intact. If there is a gate to come in and out, you want that gate to be like closed. And whenever you want, get it open. Whenever you don't want, it's closed. The hinges are there. They're not hanging like that. So you want like wild animals or strangers not coming in. Your kids are safe inside. This is your fence. So this is your GI tract all the way down. It's like your fence for internal of your body. So if that fence, if that GI tract, if that tube gets whole, which means the doors get like clinky or open, so things that we don't want that to come in, they come in. That we call it leaky gut. And the other things that I want to mention, this tube, it has trillions of microbes, good and bad together, mostly good, hopefully, that these, we call it microbiome. So what microbiome does, they are responsible for so many different areas in our body, like from producing nutrients, vitamins, and till immunity and hormone balances and all those things. So this tube has trillion of microbe called microbiome. What we want to have, we want to have a good intact, good variety, good quality and quantity of microbes in our microbiome. So what happens during the perimenopause and menopause, when we get that feedback loop to the brain that we get the estrogen progesterone fluctuation, it happens. Research is showing that the estrogen progesterone helps to this fence to be intact, fortify this fence. So when we don't have that amount of estrogen progesterone, we get holes, we get the hinges coming out. So basically we get a leaky gut, and that increases lowering estrogen progesterone during perimenopause increases the leaky gut, and we get things inside our body that we don't want. And that can be a cause for chronic low level of inflammation. That chronic low level of inflammation can cause so many things. You may go through high cholesterol, high blood pressure, you may become a pre-diabetic, even that you do exercise, you do eat healthy, you're not overweight or anything like that. But it's not, it's coming from your gut, it's coming from your hormone imbalances. Another thing is that when we have lower estrogen progesterone, again, research showing that it can actually decrease your stomach acid, your hydrochloric acid in your stomach. That can cause so many different domino effects also. And, all those leaky gut, low HCl, low level of inflammation can cause like brain fog, moodiness, mood fluctuation and things like that. So this is in a nutshell how your GI tract and your hormone can go hand to hand and fluctuate each other. Yeah, as I mentioned, low grade of inflammation, you may see it in a form of high cholesterol, the visceral fat around your around your tummy. The visceral fat are the fat around the organ that we don't want them. This is not the good fat. And these are all coming from the low grade of inflammation. And now I want to bring the attention to that microbiome that I talked to you. It's a trillion of different microbes that bacteria, fungi, microbes, parasites, all those things, good and bad, opportunistic, all together. There is a group of bacteria in that mix that we call it estrobolome. Estrobolome, just imagine estrogen and microbiome all together is estrobolome. So this estrobolome, they secrete an enzyme that is responsible to, get the estrogen, the excess estrogen out, breaking down and, get it out of the circulation. But if our microbiome is not healthy, if that population of estrobolome is not there, what happens that we're not going to have that, removal of estrogen from our circulation. We have more estrogen in our body, and then that can cause estrogen dominance. That goes to more heavy periods, moodiness, all breast tenderness, all those things coming from that. So this is how microbiome can affect your hormone. In the previous slide, I talked about how fluctuation of the hormone can affect your microbiome with a leaky gut, low grade of inflammation. This time is a microbiome that the balance is not there, the good population is not there, it's affecting that you're going through estrogen dominance. Okay. So if I want to take a look at a cycle, let's go through the monthly cycle of menstrual cycle and see. This is a typical cycle. We have 5 days of menses that, the lining is shedding and we have bleeding. You see all these lines of the hormones are low. 2 of them are from your brain, 2 of them from ovaries. Estrogen, progesterone are low, so we have the shedding. This is a follicle. The body chooses a follicle among so many, and it starts to growing. So from day 6, you see the increase in estrogen and FSH. So this increase will send a signal to a follicle to grow the egg and to get prepared for ovulation. And on day 14. And this is like by the book. By day 14, you see the surge in LH. It means that it sends a signal to that follicle to burst and release the egg. When that happens, the remaining of the follicle turns to a yellow body. We call it corpus luteum. That yellow body now is responsible to produce a progesterone for the rest of the cycle that we call it luteal phase. Then think a couple of things here. If we don't have this ovulation here, if you don't have the surge and there is no, because some months you don't release an egg. If we don't have that one, then we don't have a good amount of progesterone and the second and the luteal phase. And with the lowered progesterone, we see so many different signs and symptoms. So it's very good to understand exactly what we have in each follicular phase, luteal phase, and on the day 14, 16, 15 is your ovulation, that we understand if some things happen, you have PMS, you have moodiness, you have cramps, we can relate to a low progesterone, low estrogen, high progesterone, and things like that. Here is another, I just wanted to bring you in each phase, what are the signs and symptoms, what kind of food you can have, and what kind of activity you can have. In the menses, day 1 to 5, it's a rest and recovery. Don't do anything crazy, light exercise, go and aim for anti-inflammatory foods like omegas that can reduce the cramping, and also aim for the food that are high in iron and magnesium, like spinach, dark leafy green, and things that can also help for, because you're bleeding, you're losing iron, and also for the muscle cramp, the magnesium can work. For the day 6 to 14, which is that day that your estrogen gonna go rise up, this is you're gonna feel higher energy, your mood improving, you have a little bit of mental clarity. This is the best time for high intensity workouts, and you aim for complex carb here, like sweet potatoes that can boost the energy. You aim for the foods for your brain that helps them that clarity, like omegas, that for brain function and mood stabilization. The day 15 to 17, the ovulation phase, this is the peak of your estrogen and peak of your luteinizing hormone LH, and you feel your highest here. You're on the peak of your confidence, you're energized. So this is the best time for public speaking, best time for social engagement and collaboration work, things like that. And things for the food, you want to add extra protein that can provide that balance for the blood sugar and keep up with your energy. The luteal phase, the rest of your cycle, is that the time that progesterone is actually getting very high, and estrogen going to decline. You may feel PMS, some people, and there is a reason that some people have PMS. It again gut-related things, bloating, cravings, like that. Aim for good fat in this phase that can help with the progesterone production. Seed cycling, if you're familiar, is the time for this time, and magnesium and B vitamins, food that are rich in that, like dark chocolate, leafy greens, they're very good for mood swings and cramps. So again, this is the cycle we have, and this is the cycle that we get during perimenopause. We got it premenopause, perimenopause, or postmenopause. So you see, in perimenopause, we still, in premenopause, which means we still have our cycles. They might be shortened from 28 to 26, but they're regular. We don't have any, we're not missing anything. We still have that nice peaks. But when we go to the mid-perimenopause, it's like it's all over the place. You get like 60 days no cycle, 1 month 2 cycle. So that's the time that you're in the middle. And the late perimenopause is like you don't get your period for 6 months and you get your period. You don't get it for another 5 months and you get it. So when you hit the 12 months, no period, you are menopause. Menopause is a day, is 1 day after that 12 months of no period. This is just what I explained to you. So menopause, there is no timeline for a specific feeling of these things. What I want to bring your attention to is just with all physiological changes that we go through, and you're in midlife crisis, you may be taking care of your parents that are ill or are dying parents, you have teenage kids or kids with special needs, or you're at peak of your career, you're a career woman. So all these things all together with your hormonal imbalances, and there are so much lack of information, even from the physicians, from practitioners out there. So this is a mix you're going into. But the thing is, we do not want to go against the flow of the natural flow of your cycles. This is a beautiful phase of your life, but we want to make sure we want to sail through it. We want to make everything's flawless, and we don't need to experience so many of different signs and symptoms that I listed here. It's not only hot flashes and night sweat, actually hot flashes, night sweat, and vaginal dryness is coming at the very late perimenopause and menopause. The first sign and symptoms that you may experience and you don't know is related to this is moodiness, irritability, all those things, fatigue, the things that, dry skin, dry lips, dry eyes, all those things, your bones, your muscles gonna get affected. However, I just want to mention, we have to rule out all other things, thyroid, insulin, anemia, all those things, and then we can relate all the signs and symptoms here. Anybody's here that can pick like at least 2 or 3 symptoms from this list? Anyone? Yes? Yeah, I know. I have so many of this myself. And it's like frozen shoulder, itchy eye, dry eye, and sometimes I have watery eye. So one of the things we can make sure that this phase is like kind of flawless, like optimizing progesterone. It's a very great way to transit from premenopause to menopause. So what low progesterone, the signs and symptoms can you see? It's like heavy bleeding, insomnia, and actually progesterone can make you fall asleep, and estrogen can keep you during the sleep. So if you're falling asleep or you're waking during the sleep, that's your estrogen. If you cannot fall asleep, but you're keeping up the sleep, that's your progesterone. These are the things that you can see. Couple of the things like a natural way supplements you can increase your progesterone is chaste tree and maca. These two, chaste tree and maca, works indirectly to increase your progesterone production with working on the another hormones like prolactin, and also maca works as an adaptogen, works on your adrenal. So both of them indirectly can increase a better environment for progesterone production. And as I said, hot flashes, dryness, and these are all symptoms of very late perimenopause. There are so many signs and symptoms before that. For estrogen, estrogen actually is very naughty, and it's fluctuate 30% up and down during one day. So it's very hard to control it. It's very hard to measure it, but we need to have a picture of where we are in terms of estrogen. You might see so many different results if you measure it different times. But the things for estrogen, we need to be careful. We need to make sure our gut health is there, strobolome, remember. We need to make sure our kidney detoxifying it pretty well. So gut health, liver, kidney and liver health, liver detoxifying it, beautifully with no obstacle, and liver health. So detoxification pathway should be open. Your microbiome should be there, and exercise and lifestyle. What I recommend for my client in my practice, because you need to know this fluctuation of hormone, estrogen, progesterone, as I mentioned, can cause low level of inflammation. They can cause high cholesterol, like high glucose. So we need to know where we are in that picture. So for the blood test, these are the tests that I always recommend. We need to have a picture. Inflammatory markers, complete thyroid panel. The thyroid panel is very important, not just TSH, the whole complete panel. Insulin level, glucose level, and cardiac risk markers. In my giveaway today, I give you the whole table of these markers with the description, what you gonna ask for your doctor, what are the details. So please go and take a look. This is a very good document to have. Another test that I do in my practice that I love them is functional testing. Is actually not based on the blood, is based on the urine and stool. And we call one of them is Dutch test and the other is GI map. Dutch test give us a good picture, not only for estrogen, progesterone, testosterone, and all those things. It's showing me the cortisol, it's showing me the metabolite, it's showing me if the liver is working, it's showing me the pathways are open or not. GI map, same thing. It shows me if there is a leaky gut, there's a dysbiosis, if the good bacteria is there or not. So these are the tests that I highly recommend if you're considering to start this journey and have a better picture. Go and check them out. Okay. So with that was the first part of our talk about hormone microbiome. I know that was quick and fast, but let me know if there is any question. Put it in the chat. We can answer at the end. And let's go to our second part of our talk for today, which is about focus and your brain. And I'm going to introduce our amazing guest speaker, Azadeh. Azadeh Nasrullahi Nia is a registered counselor and registered clinical counseling hypnotherapist in Canada, specializing in treatment of trauma, anxiety, depression, and chronic conditions. Through her unique combination of sleep, psychotherapy, hypnosis, and meditation techniques, she has profoundly impacted the lives of many families. As a life coach, she has also guided individuals in reaching personal goals, such as habit changes and academic success. Her latest work, blending clinical expertise on neurodivergent individuals with hypnotherapy, has proven to be highly effective and beneficial for numerous families. For more information about Azadeh Nasrallahi, visit her website as taichiconsulting.com. Okay, Azadeh, I'm gonna stop my sharing, and there you go. All yours.
Thank you, Azadeh.
Yeah, of course.
Thanks. I just share my... Awesome. Hi, everyone. Hi again from rainy Vancouver again. Hopefully soon to be sunny. I'm so happy and humbled to be here again to share lots of more information, fun information today. As Azadeh introduced me, I'm a registered clinical hypnotherapist for those of you who join us today. Okay, let's see what we talked in last past sessions. We talked about the fact that as a mom, we are core of our family, and our mental health, emotional health, and physical health balance can change the dynamic of our house and the atmosphere of our house, and can lead to happiness and success of everybody, especially our kids. Also, we talked about, in the second session, we talked about how can we obtain more focus, more brain health to stay balanced and to be present for our kids. Today, still, we're gonna cover the topic of the focus. We talk about diet and hydration and how can we apply this knowledge, because sometimes we know about diet, but we have kids that they don't listen to us or they are choosy eaters. So today we will learn how can we deal with them. Also, we talk about other parts of lifestyle that we can change with small changes. We have better focus, or our kids can have better focus, like sleep, our movement, grounding, and we talk about it in the second part of this workshop. Also, we talk a little bit about structuring new habits, what is punishment and reward system, lots of activity and games, and the most important one, how can we benefit from grounding, hypnosis in everyday life, and also in specific matters if we have any problem. So let's go back to focus. If I just want to tell you 3 sentences about focus, about diet in focus, is that diet is crucial. No matter how much we exercise, how much we are healthy, we're having a healthy lifestyle, diet talks loud. If I wanna tell you just in 3 sentences, protein and fiber-based diet is very important. Use supplements, because our foods may not have that dosage of vitamin and mineral that we need. So we need those supplements, and we can get help from natural foods like mushrooms, like saffron, dark chocolate, honey, and etc. I remember I had a client, I just told her to use saffron 3-4 times a day, and she was on antidepressant, and after 1.5 months, she stopped her pills. So take it seriously. Like, natural foods are awesome. I think Azadeh will talk about all of them soon for us. So here are just a glimpse of how diet promotes focus and cognitive. These are the most important one. Normally, for focus, everybody talk about omega-3. Omega-3 is very essential for our brain health. It improves our memory and cognitive function. We can find it, everybody knows, in salmon, sardine, walnut, flaxseed, and chia seed. Antioxidants are crucial too. Why? Because they reduce inflammation and stress. And you know, in neurodivergent family, or if a family faced a trauma, we have lots of inflammation in our gut and also in our brain. And that can be one of the causes of even ADHD, ADD, or other disorders too. So with reducing inflammation, we do a lot for our kids and also for ourselves. We can find it in berries. Just make sure they are organic, because we don't have pesticide in our body. Dark chocolate, spinach, and kale. Then we have whole grain, you know, quinoa, brown rice, whole grain bread. These like whole grains are important because they are supply of glucose for our brain, and you know, brain feed from glucose. Leafy greens, spinach, kale, broccoli, they are full of vitamins, folate, and also I have it lutein here. I'm sure Azadeh has lots of more information for you. I just go over them very fast. We have nuts and seeds like almond, walnut, sunflower seeds, and pumpkin seed. You can use it on your salad, on your shake, in your shake. For kids, they are full of antioxidant, healthy fat for our brain, and you know it feeds from fat too and promote brain health. Lean protein, everybody knows about protein. Chicken, turkey, please have eggs in your mind. Eggs is a complete food for your kids, and Greek yogurt as well. Okay, we have fruit and vegetable for mineral and vitamin. Now we are talking about brain health and brain focus. Beets are one of the most important one because it improves the blood flow to the brain. So you can use it as a dessert or on your salad. Dark chocolate is full of caffeine, flavonoid, and antioxidant again. Improve mood, and just be careful, not be careful, I mean, just note that choose 70% cacao, because the important part is the chocolate part, not the sugary part, okay? Green tea, it contains L-theanine and caffeine, promote focus, attention, and relaxation. And the last one is hydration. Mostly during a busy day, we miss this part, which is crucial for our health. And I'm going to tell you why. These are the key points why hydration is super important for our brain health. It is important for our cognitive functioning. We need adequate hydration for a good cognitive performance. A study shows even like 2% decrease in our water amount of our body can negatively affect concentration and mental clarity. So be sure both you and your kids are hydrated, and you can help them to know how much they need. Like when you fill their water bottle, just ask them, finish this, or fill it again. You need 3 full water bottle. You need to have 2 at school, 1 here. You can just give them an estimation how much they need. Water is very important for production of our neurotransmitters. You know, neurotransmitters, we talked about them last time. They are chemicals that transit signals in our brain. So we need hydration for that, because they are supporting our mood and also our brain focus. Also, our brain needs nutrition, needs oxygen, glucose, and also needs this blood flow goes there. And water is essential here too. Temperature regulation. All of us has this I think, experienced that in summer days, we feel fatigue, lethargic, and we feel our focus is decreased. So this is the reason is that in high temperature, when our body temperature goes up, we are overheated, we cannot focus, and we need water to keep our temperature balanced. It's used for our mood regulation. Dehydration is connected to being moody, and when we are not in a good mood, we cannot focus, we don't have attention. So it's crucial for that to be well hydrated. Cognitive fatigue. What is cognitive fatigue? When we are dehydrated, we don't feel focused enough or energetic enough to just decide, plan, or follow a schedule, okay? And it shows itself with headaches, and you feel you don't have patience for something, or you just leave the problems. You're not there to solve them. So that's another reason we need hydration. How much is enough? Mostly they say 8 glasses of water, which is 2 liters for us. But you should see for your kids and yourself, how is your lifestyle? If you do lots of sport, it's different than this. It must be more. Okay, now we talked about all the information about diet, hydration, and everything. Now, how can we apply this? For example, if our kids say, oh, I don't like fish, I don't like to eat nuts and this and that, if they are picky, if they are not listening to us, how can we apply this? Because we need diets, good diets for focus. However your kid is it neurotypical or neurodivergent? You can put your kid in these 4 categories. Whether they are sensitive to special texture, color, smell, sometimes they say it's too rough, too soft, or they are not eager to eat in general, or they don't eat enough, or we don't think they don't eat enough, they eat enough, or in general, they forget to eat. And we see this in neurodivergent kids a lot because they are busy in their minds, in their words, and they forget. So let's go one by one. If your kid is sensitive to special texture, if they are choosy, the only thing you can do is to be creative and change the form, the texture, the component, mix them, change the shape and the size. I always, my example is egg, because we can have different kind of like scramble or boiled or this or that. And on the right, you can see my kind of egg. Actually, it's not mine. My husband's made it. It's a protein pancake that has eggs too. So you don't need to stick to one kind. If they don't like it, be creative. And sometimes I tell my friends, okay, sometimes you need to make money, and sometimes you stop making money and start being creative, Mom. That's the difference. If you want to change a habit in your house, you need more time and more creativity. The second group are people, kids who are not eager to eat, or they're using medication. There is a reason why they don't eat. I want you to invite to find out what suppresses their appetite. In my clinic, I found lots of good information. One of them is the snacks. Sometimes we gave them high calories snacks like banana, like bars, and the lunch is right after, or the dinner is right after. And after 1 hour, they're not hungry to eat. So they miss the main course. Be careful about the snacks. The other one is medication. If you have ADHD or ADD kids, and they use stimulants, these medications suppress the actually appetite because they're increasing dopamine and norepinephrine, which results in like burning lots of calories, which means they are burning calories. They don't need to eat. That's the reason. So you need to just talk with their teacher, use notes. I will talk about it in next slide, but just be aware of that too. Lack of sleep is one of the most important reasons. If they are tired, they cannot eat well. So the first thing you need to do is make right that pattern. If it is a one-time thing, you come back from party, your child didn't eat, just leave it there. Just don't argue with them because sleep is more important. And the next one is anxiety and stress. I saw lots of clients in my clinic that they have problem with morning routines, or parents has problem with each other and kids doesn't eat. Why? Because stress hormones put you in fight and flight mode. I will talk about it in detail a little bit later. And when you are in fight and flight mode, you want to run, you want to fight, you want to save yourself, you don't want to eat. There is no energy, there is no focus, and there is no blood flow in your digestion system. So anxiety and stress doesn't let your kid eat. And sometimes this anxiety and stress is at school. You should find out where it is. And the third group was not eating enough. Here I want to talk about how much is enough. Is it a reality that our kid doesn't eat, or is it our expectation? Most of us, at least here in Canada, we come from cultures that eating is very important. Eating is part of the fun, is showing the person is healthy. So they pushed us to eat, and we pushed our children to eat. Eat. I remember when I was in Iran, when we were in a party, we were starting with starter and then salad and then main food and then dessert and then fruits and then tea. You know, when you imagine it, it's like too much for our little stomach. And now we have that habit, and we just need our kids to eat a big portion. If your background from my experience, because I had this like from African, Mexican, Persian, or Indian country, hello, you need a background check here. So just check your kids' body type, how much they do sports, how much they are active, how much is their stomach, and then we should expect them to eat this much or this much or this much. Okay. Also, I want to just give you this information about our body cycle. Azada just explained it beautifully for ourselves. For example, when we are in special cycles like pregnancy, like ovulation, we need more food because we are creating something, okay? We are making our body ready to have a baby or ready to have an egg, and this kind of thing. It's the same for children too. Children, just before they grow, they get higher or get stronger muscles, they eat a lot. And after that, you can see that they don't eat a lot. So there is a cycle for them too. So they don't push them. And the fourth category is people who forget, which is mainly ADD, ADHD, and autism kids. How can we help them? We can help them with talking to their teachers or caregivers that remind them, because they're full of excitement, they forget. We can use timers, give them watches with timers on it, or set a timer on their phone if they're older. Also, we can use the stickers, notes on their agenda, lunch boxes. These are my stickers for my daughter. that you see, and I have stickers for her agenda to bring your coat back to this. So stickers are amazing. And the fun thing is that I used these stickers for 2 years, and now after 2 years, she replied me on another note, which is cute. Okay. What if in general, we do all sort of thing and they still don't eat. So we need to use high calories, high protein, dense food, like shakes, bar, small bites, and nuts. If you see you put rice and chicken and your kid doesn't eat, protein is more important. So put the protein first. So you be sure she get the protein. And in the evening, you can have another part like rice with something else. So choose small bites, but high calorie, high protein, and dense food. And you see lots of picture here like shakes. Shakes are so fun, and you can use them in the morning too. Here are some general solutions. You can get like help from spices, natural sweeteners, natural foods, cinnamon, maple syrup, honey. That helps you change the taste of the food. For example, for egg, because I give my daughter lots of eggs. It was, I think, 2 nights ago. If you see the middle picture, 2 nights ago, I just thought, okay, too much egg, it's boring now. And I add some maple syrup and raisin in it, and she had a new taste with egg. So you see these are all homemade that you see. You can use sometimes dark chocolate on it with fruits. And the other picture, you can see a popsicle. My daughter, that was a time that she didn't like to eat pineapples, and I made it in a popsicle, and she ate it and say, "Oh, mommy, it's really yummy. What is this?" And say, "Okay, here we go. You like it." The other solution, you can make it colorful plate. You can decorate the food. Which one do you like more? You can answer me really. Which one you prefer? The one with flour and lots of nuts and design, or something mishmash? I don't say the left picture, the left food is bad, but just imagine if you have it every day, it's boring. I wonder if anybody said the left picture.
No, I was tempting to say left one because it looks yummy, but the right one is beautiful.
Okay, and you prefer it every day or just one day?
No, probably once every other day.
Okay. There are other general solutions. Okay, you can, if, for example, if your food is repetitive, you can make it fun. What I use is 5-minute contest to design and decorate the food, like the pancake with fruits, and or photo shoot contest, or these kind of things that the food is repetitive, but you do some fun activity, you add some fun activity, and there you go, they eat it. Tell them about nutrition facts. What is gut food, what is brain food, what is superfood, and they learn little by little and they enjoy it. Leave notes for them why they are eating this. Again, these are my notes. If you see, for example, on one of them, I wrote, today you have rice for vitamin B, fish for omega-3, yum, yum. Or the other one is vitamin C station today. Or the other one is very funny, some fiber for happy poop. That's you can use this information because sometimes when it's hard for them to poop, you can just tell them, oh, we need some fiber probably. And the next day you put some fiber and they eat it. Don't push them, but don't give up. Introduce all taste. And as sooner as better, sooner the better. Because it reduces sensitivity when we introduce food when they are younger. set some rules and obey them yourself. For example, in our household, we have first main course and then dessert, or we have first protein, then carbs, or we have 3 bites rules. And if I don't like something, I have go for 3 bites rules to see if I like it or not. And if I don't like it or she doesn't like it, we stop it there. Set time and place. We talk about it when we have a setting for our food, our brain connected and conditioned to eating. So I really don't like the settings that people are eating all over the house, everywhere. I mean, sometimes it's fun, but normally if you have a choosy eater, set some place for that. And if your kids need to be comfortable at the table, help them. For example, for neurodivergent kids, I show you here, for example, we have these fidget, they can fidget or they can draw, or you can have these rubber bands on their seats so they move their feet and they be able to sit, because it's so hard for them to sit. It's not that they are impolite, as grandparents said, they are uncomfortable there. So we need to help them to be able to sit still. And the most important part is eating together, at least one main course a day. It's very important. You're talking about your day, you're connecting, and please don't miss that. I read lots of studies that shows for like later ages, when they have problem, but they have this connection to their family, they come back. Like regarding addiction, we had a study that shows it's very interesting, that shows kids with addiction who had dinner time with their family, they normally go back and they get back to health, but the other ones no. So this connection is very important, and just bear it in your mind. I just want to check with Azada how much more time we have. Should we
You
continue?
have about like 4 minutes if you want to use that.
4 minutes.
Do you want to put it for the next session?
Yeah, I can do both way. However
Okay.
you.
It's up to you.
Okay, let me.
Okay.
I think if it is 4 minutes, we can go for a break and come back and have the whole things together.
Okay, then. So thank you so much, everybody who stayed with us. Please stay a little bit longer. We're gonna take like about 5 to 10 minutes break just to have a water, washroom trip. And then we come back and Azadeh gonna continue her talk. And then I will continue after that, going through more hormones and tips that how we sail through the perimenopause into menopause, and what now we can do. And I'm gonna talk about neurotransmitter a little bit. Okay, this Zoom gonna be open. So I'm here. If you have any questions or any things, feel free. I'm gonna stop the recording. And now we can talk.
Thank you so much. Amazing. To
You're
double Azadeh rock.
Yeah, double Azadeh. Whose iPhone?
Yes, that was great. Thank you. I don't know. Hi, it's Roxana here. Do you hear me?
Yeah, I do, but whose iPhone too?
You do. I don't know.
Okay.
I was on iPhone, but I switched to my desktop, so
Maybe it's
I
still
shouldn't be
your
on.
iPhone.
Oh, maybe it's me. Okay, let me switch. I think it's still. Okay, now I'm on iPhone, so I have to go back to my desktop.
That's okay. So Ramesh, Alexandra, do you have any? Oh, I think I can hear myself through your phone. Do you have any questions, any comments, anything you want to hear more or less?
Wow. It's everything was clear, and thank you both of you, because as a woman, we go through so many stages from when teenage start, everything, the relation and everything, and then premenopause, menopause. It's a journey. I learned my lesson, and definitely I am in all of these things to explain with you guys. And definitely every step, every knowledge, every awareness through this journey will help. Thank you very much.
Oh, you're very welcome. So, in the next hour, I'm gonna tell you what we can do in terms of, easing off the signs and symptoms, because I know some of us are in peri, some of us are in menopause, and I know some of the people who registered and they want to watch the recording, they are at the very beginning of the perimenopause. So I hope this help them I stopped recording actually, that help them to, go into it more educated. الان فکر کنم فارسی میتونیم
Sounds good.
رکورد که نیست.
همه فارسی شدن؟
همه ایرانی
همه فارسی شدن.
Yay!
همه فارسی شدن. That's good.
خوبی رکسانا جان.
مرسی. من دیر اومدم، 12:20 بود، توی یه کال بودم تا بیام، یه کمی طول کشید، ولی ریکوردینگ اینا رو داری نه؟ بعد شیر میکنی؟
بله.
آره، قسمت شما رو میس کردم، ولی قسمت اون یکی آزاده جون رو دیدم. گفتم که توی چیز گفتم خدا رو شکر بچه های من این چیزا رو گل و نمیدونم اینا بچه که بودن همین غذا دوست نداری برو یه چیز دیگه
برو یه چیز دیگه بخور دیگه، همینه که هست.
برو سریال بخور. اصلا حوصله نداشتم من براشون این کارا رو بکنم.
I know. ولی من یه چیزی فهمیدم، وقتی یه بار آدم خودش میکنه that becomes easier.
آره.
به خاطر اینکه مثل اینکه همون چیزش میشکنه آدم دستش کار کنه.
خلاص از من که گذشت. Good luck to you guys.
Okay.
راجب بچه هایی که خیلی چوزی هستن،
آها.
مشکل اصلی بیشتر بچه های نورودایورجنت هن که خیلی وقتا
درسته.
دی واقعا نیاز دارن که این در واقع پروتئین رو داشته باشن، به خاطر نوروترانسمیترها، به خاطر
درست.
گات هلت و به خاطر اینکه ماسل بسازن. و شما میبینین که یهویی اینا فوکس میکنن مثلا روی یه دونه مثلا چیکن ناگت، یا همه عمرشون دارن چیکن ناگت میخورن و با جیغ و داد و خیلی براشون سخته که این رو عوض کنن.
درست.
ما فارسی هستیم فکر کنم، همه دیگه داریم فارسی صحبت میکنیم.
بعد اینترستینگشون کنی، اینترستینگ کنی براشون.
و واقعا باید این هابیت استراکچر بشه، به خاطر اینکه خب فور نورمال که به قول شما آدم یه دونه، حالا نمیدونم شما بودین یا نه، توی فکر کنم اولین ورکشاپ من گفتم برای بچهای نورمال ما خیلی راحت میتونیم یه داد سرشون بزنیم و they listen، ولی متاسفانه بچهای نورودایورژن نه که گوش نمیتونن. اینو ابیلیتی رو ندارن که بفهمن و هر مخالفتی باهاشون اونا رو توی یه لوپ بدتری میندازه.
درست.
یعنی
لج و لج بازی میشه.
بله، و این وقتی که زیاد میشه استرسشون هم زیاد میشه و هی این لوپ بزرگتر و بزرگتر میشه. من خیلی از کلاینت هایی که دارم یعنی در واقع انقدر این چی بهش میگن پاور استراگل دیگه زیاد شده که اصلا بچه هیچی رو گوش نمیده، یعنی در واقع هیچ چیز رو گوش نمیده. بچه های نورمال اینو میفهمن، یعنی اندرستندینگ اینو دارن که خب بابا تایم غذاست و مثلا ما با اون بچه ها میشه این کار کردن، ولی نیاز داره که یه خورده بزرگتر شن و وقتی کوچیکن ما این مشکل رو داریم که ما فود خیلی خوب بهشون برسونیم و نمیتونیم. متاسفانه من خیلی توی دوستا و آشناها میبینم که مثلا بچه های آتیزم دارن، بچه های چیز دارن و فودشون از همه بدتره و اصلا دوای دردشون مثلا پروتئینه و فقط مثلا دارن کنفلکس میخورن. شاید برای بچه نورمال یه روز اینو میخوره مهم نیست، ولی برای اونا متاسفانه این میشه یه روتین و یه لوپه میرن توش و دیگه در نمیان و هرچی هم این
مهم.
هابیت استرانگ تر شه سخت‌تر میشه عوضش.
درست.
شاید به قول شما برای بچهای نورودایورجنت خیلی
آره
مهمتره این نکات. راست میگی.
ولی نه خیلی خوب بود، خیلی خوب بود. good information.
خیلی ممنون.
آره من مشکل فوکس و اینا دارم دیگه، گفتم که من کجا الان ساعت 1 شدیم، نمیدونم کی میخواین شروع کنین آزاده. آره فوکس کردم، باید ببینم چه جوری میتونم که این فوکس رو چیز بکنم،
اوکی
بهتر
الان
کنم.
الان شروع کنیم. بذار
الان کنیم،
الان بکن.
الان بذار شروع کن.
همین الان.
این دومیش راجع به چیه؟
دومیش آزاده بحث رو ادامه میده، بحث خودش رو.
اوکی.
منم قسمت اول راجع به سایکل گفتم، راجع به گات مایکروبایوم گفتم، تاثیرش روی هورمون، تاثیر هورمون روی گات مایکروبایوم.
مهم.
حالا اینجا و اینکه چه اتفاقایی میفته توی منوپاز که اینا فلکچویت میشن. خود سایکل رو یه توضیحی دادم. حالا الان میخوام بگم حالا through the perimenopause و menopause چه کارایی میتونیم بکنیم که مجبور
مهم.
نیستیم اینقدر این ساینا رو تحمل کنیم،
درست.
فلوش بهتر باشه. همین.
very good.
اوکی بذار پس من آفیشالی استارت کنم. کجا بودی؟
ما راجع به دایت صحبت کردیم.
یا چیز تو؟
الان شعر نیست؟
چرا؟ بذار من فقط میخوام که شروع بکنم. یه دقیقه استاپ بکن شعر تو.
اوکی.
بیا روی
Oh, just a moment. Okay.
اوکی بذار من یه دونه فقط یه ریمایند بکنم که ما کجاییم و چه داریم میکنیم.
الان من راجع به لایف استایل، تاثیر لایف استایل، مدیتیشن، اکتیویتی، گیم.
آره نه میخوام برای کسایی که تازه الان میخوام جوین بشن. اوکی.
آره همین.
Okay, everyone, welcome back. Thank you for staying with us for the first hour. I just gonna quick recap what we talk about. In the first hour, I talk about the gut microbiome and the GI tract, the effect of hormone imbalances, estrogen, progesterone on microbiome, and vice versa. And I also talk about our cycles, monthly cycles, what happens during each of those times, what we need to eat in terms of the optimizing the time that we are in that phase of our cycle. And then Azadeh, our amazing guest speaker, took us to the journey of the focus, the effect of nutrition, what we need to have for a better focus. And she provided lifestyle hacks and so many tips for picky eaters, for kids, and changing the habits and things. Actually, she's gonna talk about changing habits right now. So this part, again, for 1 hour, we're gonna talk about habits, focus, and we're starting with Azadeh, our guest speaker, and then I'm gonna talk more about perimenopause signs and symptoms, and now what we need to do to sail through this phase, because this is a natural phase and we want to have less severe symptoms, but we just need to go through this phase with ease. Okay, without further ado, Azadeh, here you go.
Thank you, Azadeh. Hi again for those who join us now. And seems we come back from share. Okay. Yeah, here we are. Okay, as Azadeh mentioned, we just talked about diet, hydration, and how they boost our focus. Now, we want to see how can we structure a new habit. It has many phases, but today I'm gonna tell you the first step, which is I think the hardest step for everyone. But first, let's see what is a habit. A habit is a routine of behavior that is repeated regularly and tends to occur subconsciously. It's easy for us. So in a simple language, what will happen in our body is we do something for the first time, for the second time, for the third time, we make those neural pathway to the point that automatically we do that without spending any energy or effort. We should know there is no, we can structure a habit with pushing or forcing our children or ourselves, but it's not good. And I'm going to tell you why it's not good soon when I'm talking about punishing and reward system, okay? Okay, let's see what is the first step. I choose this first step because I'm hypnotherapist, and in hypnotherapy, the first thing I do when somebody has phobia or somebody has difficulty to do something, the first step is introducing the subject to them. What does it mean? It means without any attachment, without any responsibility, they need to be introduced to that subject. For example, just imagine you want your kid to have broccoli beside her food, okay? Just put the broccoli at the side. Don't expect them to eat. Don't expect them to eat after even 10 times. Don't make it drama, no comparison, no judgment, nothing. It's just the first step, and we need them to see, to feel it, to experience it, get comfortable with it. Even you can say, don't eat it if you don't want to. And this is not just for food. This is for all the habits. For example, your kid watching TV and eating, and you want to change this habit, okay? The first step is introducing. You sit with the whole family on the table and you just say, we can sit here, you can come here with no pushing, okay? So this is the first step, and that's the most important one. Just imagine, I just want to show you when we push them at the first step or after 1 or 2 weeks, what will happen. Just imagine you're afraid of, I don't know, a snake. And you come to me, and in the first step, I say, okay, see, this is a snake, and now hug it. You can never do that. So we cannot expect our children to do that when they don't like something, when they're afraid of something, when there is another habit working in their system. Okay, so the first step has no pushing, just introducing. Here, the plan. The structuring a habit has a big plan, but like when we want to change a habit or apply a new habit, it's really hard, and it's hard work. Here is my one of my clients' kid. I changed the subject and the food, but it starts something like that. We start with introducing. The next step, we normalize it, then we add fun, and then depends on the age and depends on their problems. We give them choice, small amounts, and so on. Just we should be aware that we change one habit at a time, whether it's for you or for children, one habit at a time. We do the same for in hypnotherapy too. There are lots of people come to me and say, oh, I'm here to pass my exam, and then say, oh, hypnotherapy works for getting thin, losing fat. Oh, I want that too. Or can I use it for my children too? I'm really shouting at them. So we cannot do all of them together, because if you remember last time I talked about when you're opening many tabs in your mind, your focus decreased 40%. We don't want that. So in therapy, we want all the focus on one thing. In habit structure, we want all the focus on one thing. So if your kid shout, has bad sleep pattern, has bad food pattern, we cannot change all of them. We do the core one, the first one, the most important one. Here I want to talk about punishment and reward system, whether it's for you or for your children. What is the punishment? and reward system. Let's start with punishment and old methods. Yes, if you tell your children you have to do this, you have to brush, or you shout at them, they may do it. Or if you force yourself to do something, you may do it. But just imagine those neural pathways go stronger and stronger, and it combined with that bad feeling. The bad feeling is every time I don't want to brush, my dad shouts, so I have to do it. So years will pass, and you see they grow up, and still when they want to brush, they're hesitant, or their body gets full of cortisol. Why? Because the body remembers all these connections. As soon as you get the brush, you feel that bad feelings that you had when you were a child. So really, punishment doesn't work. But how can we do with reward system? What is reward system? Any method which is story, game, any interactive method can be reward system, okay? And study shows it helps your focus by 40% compared to those traditional approach. If you are a parent, if you do it for yourself, be kind to yourself. If you are a parent, be firm. Put the broccoli for 1 month, even if they say, I don't want to, you just say, yeah, it's okay. You just try it. Firm, but fun. Here I want to talk about activities and how they affect our brain. Okay, so if you have problems sitting still, or your child has this problem, or if you have ADHD, attention deficiency, there are many things that you can use to help you to sit still. And we can help ourselves or our kids get regulated better. Normally kids with attention problem, they like to play with one object, or they have kind of rhythmic movement, like they bouncing their legs, they tapping their fingers, they wiggle, or they really love to push something like ball, or they do the pen clicking. I don't have pen to show you, but they like these pushing actions. And also, as I said, squeezing, like gripping a stress ball, or playing with Play-Doh. Also chewing gum. These are very helpful. If they need to sit and focus, or you need to do that, you can use all of these materials. You can, as I said, you can have the rubber band on your seat, or twirling chair, or a stress ball, or they can sit on yoga ball at all. And all of these are helpful. Sometimes if you feel uncomfortable for yourself, you can start writing or journaling. For your kids, they can scribble, or they can start with coloring. Stress goes less, and they go back to parasympathetic nervous system. Here I want to talk about games. All of us know games are inherently enjoyable, and they boost the good hormones like dopamine in our system. Why games are fun? Because they provide immediate feedback. They reward you. They are short in duration. They are achievable. And after each steps, you see the result. You get the feedback. You get the reward. If it's digital, you hear the sound and click and coins and cheers, hurrah, you get the reward. So if you need focus, or especially for your children, you can do the homework or task like games, small, achievable, like explain the steps and then give some rewards after. Or you can add games before and after a task. That helps them to get more focus. Why more focus? You know, dopamine, less stress, more focus. These are some examples, like you can write 2 sentences and 10 jumps, or we do rock, paper, scissors, shoe. And then if I win, I tell you start a task. If you win, you tell me what to do, something like that. But be aware, not digital games, because who can tell me why not digital games are good for enhancing our focus before a task? Any idea? Okay, no worries. I let you know. Digital games are really stimulant. They give us rush of dopamine, and the dopamine, when the dopamine is super high, the body needs to get active. So we don't get the same reward from writing or doing a task. Okay, these are less fun than digital games. So with rush of dopamine, with less interesting tasks, we don't have fun. So these are not good. Like digital games are not good before any task for focus. Okay, here are a list of games. We have all sorts of games for children: movement, obstacle, mindful playing, all sorts of games. If you like, I can send you, you can email me and I can send you the list, and you can play all of them with your children. Some of them are good for motor function. Some of them are good for stress decrease, and some of them are good for sensory, like all sorts of games here. But I want to just give you one example about like kind of breathing exercise. You can ask your children if they are stressed or they don't want to leave you or they have problem with something. You can use your hand and tell them, okay, start inhale and exhale with me. Like inhale. You can do it with me now. It's really working. And exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, and exhale. It's fun, and they can see their hands and the order that they should do. So,
That was fun.
what's that?
That was fun.
It is
Interesting.
fun, yeah. And the other exercise I know for like being mindful, sometimes when they are very stressed, I give them a cup full of, or they can just imagine this is a cup full of hot chocolate. It's hot, super hot chocolate. And you should blow it in a way that the hot chocolate won't go out, but it gets cold, okay? So it's like inhale, exhale and inhale like it. It's very calming. It's really soothing. You can use all sorts of things for them and yourself. Okay, let's talk about sports. I don't want to put lots of time here. Just in general, study shows that doing sports affects learning in every aspect, like improving focus, increase blood flow to the brain, executive functioning, releasing good hormones, and everything. And unfortunately, I see in, especially in my culture, in some cultures, most of the people put their children in, from very young age, they put them in study clubs and I don't know, Kumon or studying because they want smarter kids. But they don't have this information that if they want smarter kids, they should put them in sports, because sports help them to make new neural pathways. And with more neural pathway, learning is easier, understanding is easier, functioning is easier. So focus is more. So we should take it seriously. Sleep. Sleep reduce mental fatigue, give us emotional regulation, and it balance our neurotransmitters and lots of other benefits. But here I want to talk about memory consolidation, which means when we learn something, it doesn't sit in our mind until we go to deep sleep. In deep sleep level, it forms there. We learn it. That's why many of us study in our younger age, and it was one night before exam, and we study until morning. We go do the exam very well. After that, we don't remember anything. This is the reason, because we didn't go to deep sleep, and all the information just escape from our mind. I want to tell you, like, it's very important also for my therapy, like hypnotherapy. The first thing I check with my clients is sleep, because the new pattern, the new emotion get fit in our brain. So count it, very important. Grounding. What is grounding? We talked about it. Is putting our bare feet or our bare hand on earth, anything on earth, nature, grasses, sands, mud, and how it helps us in exchange of electrons between our body and earth. It reduces inflammation, it reduces stress, it reduces glucose level, and all of that helps us to focus. So grounding is very important, but ignored in recent years. Before all the kids were barefoot, running outside in the nature, playing. And maybe you notice when it's summertime, you're at beach, you feel really good. It's not just the sunshine, it's not just the nature, it's because you are bare feet on the sands or touching water, sands, and your body too. So it's very important. Use it for your children and also for yourself. The other one is meditation. What is meditation? Like, in simple words, is sitting still, going inside, clearing our mind from thinking with using combination of mental or physical techniques. Meditation is a spectrum. Like, it can be simple, taking few deep breaths to bring your attention back. Like, you can close your eyes, bring your attention back to your heart or to your breath for a few minutes. This is meditation. Also, it can be improved to the level that you regenerate the whole body cells. This is what you see in Tibet. They have no aging. They don't need food. They don't need sleep. Why? Because the energy level is so high that compensate for everything in their body. So when we say meditation is like many things, and especially in recent market, we have all sorts of meditation. How it helps, it regulates our nervous system from sympathetic to parasympathetic, and I will explain it right now. How can we use it for our children? For our children, we need guided meditation or imagery or stories, kind of contemplation. So here is our autonomic nervous system. What meditation does actually is, when we are in stress, it means we are in sympathetic nervous system. We are in a state of fight, flight, and freeze. Just imagine you are running away from a bear. How do you feel? You need really energy in your hands and your feet to run away to keep yourself safe. Okay, so you get blood pressure, heart rate goes up, all the blood goes to your muscles, and you are ready to escape or to fight, or sometimes you freeze. Okay. This is the state that we face when we are in danger. But because of all sorts of stress and problems that we had back there in our baggage when we were small, when somebody shout us for, I don't know, something not important, all the other things can play a role of danger. as I told you, like you take the brush, you feel a stress. You have an appointment, you feel a stress because all the time your parents say, you should look nice, you should look enough, you should be good, you should be that. Okay. So you get a stress. Now you're a doctor, you're a professor, still you want to talk and you feel that stress. Why? Because unconsciously you go to fight and flight mode, which means you are ready to run and you are not calm. Parasympathetic is when you're calm, the blood is in your digestion system, your heart rate is normal, and your blood pressure is normal, and all of the things. Okay, how meditation helps? When you start meditating, you actually help your energy goes back to calm, goes back to parasympathetic nervous system. So you feel calm, relaxed, and ready. This is why stressful people have more fat in their body and relaxed people has less. So this is very simple and short form of what's the difference and how meditation helps. Actually, I want to explain it here that all the things that we mentioned, like sleep, like sports, like activity, like games, helps you to go to parasympathetic nervous system state, okay? Which is calmness, happiness, and being content. The other topic I want to talk about is hypnosis, how hypnosis can help us. And yeah, here. How and what is hypnosis? I show you this picture because the information is a bit complex. Okay, what is hypnosis? Hypnosis is bypassing critical mind while we are in theta brainwave and changing a message, belief, or feeling in our subconscious mind with use of subconscious language. I explain it to you now. Look at the picture. We have 10% our conscious mind that we analyze, we decide this is what we are, what we like. And 90% is our subconscious. It's our traumas, beliefs, what we get from our ancestor, how was our culture, all the messages, feelings that we have that unconsciously guide us through life. And we think we decide, but in reality, all of those things, all that packages decide for us. That's why that you just feel, oh, I'm anxious, I don't know why. Oh, I'm lethargic, I don't want to work. I'm in low mood all the time, I don't know why. Okay, because that subconscious sees something, feels something, bring up something that we don't know. What we do in hypnosis, look at the purple line in the middle. It's our critical mind. Our critical mind is like a door. Whatever our critical mind is helping us to survive, to remain survive. For example, again, a bear. A bear comes, attack us, and we just record the image, the sound in our subconscious mind, and our critical mind close the door. So from now on, whenever we see a bear or something like a bear with the same sound, our critical mind says, it is dangerous. You get full of stress and you feel you need to run, whether maybe it's not dangerous. So there are lots of messages that we don't know and they are saved in our subconscious. And with hypnosis, we actually open the door, access that subconscious, change one messages, and when you wake up, that message is changed. For example, the message that I'm not good enough, the message that I don't know, like I'm afraid of, I have this phobia, I cannot swim. Okay, all sorts of messages. So that's why hypnotherapy is very effective in a short time, and works well for us. How it helps, because it changed the message in our subconscious. It's faster. It changed our emotions too. How we use it for ourselves and our kids. 5 minutes right before we go to sleep and 5 minutes after we wake up is golden times. We are in actually theta brainwave. What is theta brainwave? The brainwave that when we go to hypnosis, we should get that level. It's very deep. So we call it even hypnosis brainwave. So use that 5 minutes before you go to bed. Tell the things that you want to change for yourself or your baby. For example, you are amazing. I am proud of you. Everybody loves you. If they have lack of confidence or if you have it, just be careful and be sure all of your sentences are positive. Because when you use negative sentence, your subconscious get the negative. When you say, I don't fear, you're recording, I don't fear, I don't, and fear. These are two words for your subconscious. Then you still have the fears, okay? So that's why if you want to go to a hypnotherapist, you should find a good one, because sometimes I see people don't have this information and they just have some simple information and start therapy, unfortunately, but just be aware of this. If you go to therapy, and be aware of that if you want to use these few minutes for yourself. Also for lifestyle, we have therapy. What is therapy in simple words? We are talking about our feelings, fear, disappointment in safe place with safe person. Why it is important for kids? I know it can be costly, but even if they don't need it, just try it every 3 months, every 2 months, and just make the habit of it. Why it is important? It reduces overthinking. If they have any problem, it helps them to do the best, make the best decision, teach them responsibility. If they are neurodivergent, they face lack of confidence. Normally they hear 80% more negative talks from outside by the age of 10. So I think for neurodivergent kids, it's essential, it's necessary. It reduces overthinking, shame, lack of confidence, anxiety, and stress. And when they are calm, they do better. Not only it gives them self-confidence, you're making a habit for them. So in the future, when they have problem, they know how to thrive. They know where to go instead of getting wrong solution, instead of getting solution from friends or going unhealthy ways. They know what to do. Okay,
So
how we use therapy?
your time is almost up.
Almost up.
Yeah,
Let me
couple of more minutes.
see. Yeah, maybe I need a few more minutes to just
Sure.
make
Yeah.
it. How we use it for kids? Therapy for kids is like not therapy, not talk therapy, is play, painting, cartoon, role play. And if they are bigger, we use talk therapy. Another thing is medication for boost focus. Sometimes it's necessary. I'm not a fan of it, but it's for some kids with ADD, ADHD, it's necessary. Just be aware that get opinion from both pediatrician and psychologist. Never use it for underage kids under 6 years old, and monitor them for long term. This is very important. Sometimes you use the medication and unfortunately it has lots of side effects and you don't understand, like they get more anxious, they get more stressed, or it means the medication doesn't work, or it works and it has side effect and you need like natural foods like ashwagandha and other things to make them calm. Okay, here we just covered everything about lifestyle, about games, movement, diet, and hydration. Here I have just a sample of my integrative method full plan. I'm going to introduce it in few minutes for you because we talked about it from first session, that how I use integrated hypnosis and other modalities for my patients and clients. I thought it's the best. You see how it works. Here is a sample of a plan. Normally we check atmosphere and dynamic of a home, time management, if they need to do any redesign, setting, use some tools or remove some items for their kids. We check parents' relationship, if they have traumas, how is their parenting style, background, lifestyle, self-care method, self-care method, self-care method 3 times. And if they have skills for being a parent for neurodivergent kids, because sometimes they are good parents, but not parents for neurodivergent kids. Also, we check kids' physical, emotional, and mental problem or disorder, if they are diagnosed or not. We do referral, school engagement, help them how to deal with the school, get help, diet, supplement, activities, and executive functioning and planning, all what you saw. Also, you saw one part of habit structure. We do a habit structure because it's very, very hard for kids with, if you have a kid with neurodiversity, you know, changing a habit is huge. But the good news is when you change one habit, the second is easier, the second one is easier. And also parents learn it and to do it by themselves little by little. And we have a hypnosis package for parents and kids tailored for their problem, which is a text or recorded voice, a story or complete hypnosis session for them to listen every night or every day. Also, I teach them how to use hypnosis rules, like what I told you, like being positive is one of them, in everyday life, in their sleep, and how to use it for connection, more connection, and faster, easier changes. This is the package. Some people get part of it. Some people need just the kids part. Some people start with one part and go a step by step. If you're interested, it's not just for neurodiversity. As I told you, I'm a life coach and therapist, and we have it for everybody who needs a change in their life. Thank you for your attention. I'm very honored that I was here today to be able to share this information and experience with you. And thank you, Azadeh, for inviting me over. Hope you enjoyed all the information. If you have any question, please be in touch. And don't forget, you have 30 minutes consultation. You can use it. Here is my email and telephone, and that's all. Thank you very much, everyone.
Okay, thank you so much, Eza. That was very amazing information, very practical. I enjoyed and learned. I'm sure everybody did the same. If you can stop sharing that, I can share mine. Thank you. Okay, let's continue. Are you seeing my screen?
Yes.
Is it big enough? Okay. So, for the first part of our talk for hormone, we talk about the gut microbiome, the effect of the microbiome on hormone imbalances, the effect of hormone imbalances on gut microbiome, and then we went through the cycles and what happens in each part of the cycles and what we can do in terms of, making it easier. So from last session, I talked about the gut microbiome and neurotransmitter too. I'm not going to spend that much time on this, but I just want to bring a reminder that how important is the microbiome, gut microbiome, to producing your neurotransmitter. Just continuing with the focus part that just Azadeh mentioned about the dopamine, serotonin, norepinephrine, cortisol, all of those things, the hormones, neurotransmitter messengers of our body. The gut microbiome has a direct effect, 100%. There are so many researchers. There is well-established line pathway between these two, that they are connected, and they affect each other. So for example, as we talked about before, 90 to 95% of serotonin is produced in your gut. The serotonin is for stabilizing your mood, feeling of well-being and happiness, what we need in our perimenopause for your focus. The same as dopamine and GABA. GABA is, for your relaxed mode. You need it at nighttime. If you have those mind of, fire and tired, wired and tired things. And so GABA is needed for that. I'm giving away a document again that it talks about these different neurotransmitters. Okay, let me talk about this one first. So disrupted microbiome, it can be because of your poor diet. You have so much stress. You've taken so much medication, especially antibiotic. Why? Because antibiotics kills the bad bacteria, yes, but they also kill the good bacteria. So we need it sometimes. It's okay. We can replace help with the probiotic, get the good bacteria up. But if you're using it for years constantly over and over, that's a bad thing. And then during perimenopause, the hormonal imbalances, as we talked in the first part of our talk, it can cause disruption in the gut microbiome, and that can affect your focus, your mood, and everything like that. And it can impair the neurotransmitter production in that time. That can lead to, if you have leaky gut in your microbiome, in your GI tract, you have leaky brain, leaky gut, leaky brain, you have mood swings, your focus is difficult, your short memory, you're walking to a room and you just forgot why I came here, what did I wanted to do? It just 10 seconds ago. You need to focus, go back to the other room and remind yourself. So these are all connected to your gut microbiome, healthy gut, and neurotransmitter, and all sort of the things. So this is the sample of what I'm providing you today as a giveaway. So you have about 8 different hormones and neurotransmitter that I brought it for you. The role in the body, the gut connection, perimenopause connection, and how to support it to balance it in our body. I'm going to give away the cortisol, insulin, progesterone, estrogen, serotonin, oxytocin, epinephrine, and melatonin. Please, when you receive it, take a look, and it would be a very good resource. Any questions so far? Any comments? Any ahas? Anything? Oh, okay, I know that. Oh, I don't know that. Anything like that, let me know. Just unmute yourself and you can talk. Okay, so now we know that we are physiologically going through perimenopause. We know that we're gonna get lower estrogen, lower fluctuating estrogen, lower progesterone. We know that we're gonna face so many different symptoms if we don't do something before that. So what we can do, definitely all we're talking this time is gut, and gut. So gut health is one of the main keys when you entering into perimenopause or menopause. Even, there is no time is late time. So whenever you do it, it's a benefit. So by gut health, I mean maximizing your gut microbiome in a way that they can increase the hormone production, neurotransmitter production, immune system focus, all those sort of things. So the rest of the list here, I know all of us know it. Just for stress management, life is happening. You have midlife crisis again. So as I mentioned in the first part, you have maybe you're divorced, maybe you have a dying parents, maybe you have ill parents, you have a teenager going through so many challenges, you have a neurodivergent kid, you are at the peak of your business, you're a career oriented woman, or you're struggling in your relationship. All those mix add to your stress, plus your own hormone imbalances. So what I want to emphasize here, continuing to Aza's talk, meditation, grounding. So I know when the worst comes meditation, some people say, okay, that's not for me. I cannot do that. It's a good thing. I've heard about it, but even if you're so logical, even if you're so critical mind thinking like that, try it for 2 minutes. 2 minutes per day. Then increase it 3 minutes, increase it 5 minutes, and make it a habit, because that's meditation, whatever form it is it just closing your eyes? Is it just listening to something? That will give you that level of grounding, putting you, as Azadeh said, in parasympathetic nervous system. That helps neurotransmitter, that helps the energy level, gut microbiome, everything. If you consistently doing it, after 2 to 3 months, you can see a big change in your mood, in resiliency, in the stress management, because we cannot remove the stress. We want to bring up the resiliency. Environmental toxicity by its own needs a whole separate talk, but be careful about the toxins around you. The added one that you can control, especially for ladies, cosmetic, full of xenoestrogens, like cleaners, household cleaners, or your personal care cleaner, shampoo, or all those things that you use. These are the things that you can easily, slowly remove and replace with the better ones. Exercise strength training is for perimenopause is a must. It's not a luxury, it's not something that it's nice to have. If you want to have your bone and muscle mass, bone density, muscle mass, if you want to keep that, you have to bring a strength training into your daily and weekly routine. 2 to 3 times a strength training for 45 minutes. And, a strength training may look different from one to one. Maybe like 5 pounds for me is enough. It's my limit, but 20 pounds for other person. It's your judgment. You have to push through it. You have to go to your limit. That will build up your muscle. That will help you for bone density. That will help the hormone, production, estrogen production. Same thing, same routine with the yoga, walking, jogging, meditation, things like that. This should be, aerobic and aerobic exercise is a part of your perimenopause, like prescription. This is a must, and bring it to your daily life. It's a non-negotiable things. It should be non-negotiable. Even if you're too busy, that should be there. Diet, aim for whole food, anti-inflammatory diet. Ultra processed junk. I know, we all know this is no brainer, but it's okay. You can follow 20-80 rules. I tell all my clients, follow 20-80 rules, enjoy the life. Sometimes, we eat, we indulge, but overall whole food, anti-inflammatory. And I'm going to talk more about these things in the next slide, but with these things, can they change the outcome, the onset? No. But can they change the severity of the symptoms? Absolutely, yes. So if we have better health in our gut, if we do balance vagus nerves, parasympathetic nervous system, if we remove toxicity, so definitely the heat of the symptoms is less. They're more manageable. We notice them, we prevent them, and we go with the flow. So for the food, what we can optimize, one thing that you can pay attention is your protein portion intake. Like the rule that we always saying that go for 1 gram per pound of your ideal body weight. So, and if the calculation is really not there for you, whatever weight you have, go aim for 100 plus gram of protein per day. That is a must for, maintaining your muscles and boosting your metabolism. That will help you for the blood sugar stability. That will help you for reducing your craving and satiety. And also that will support the production of your hormone. Everything in your body is amino acids, it's protein. So we need the building block for that. We need to provide the body. And then aim for good protein. If you're familiar with glycemic index and glycemic load, aim for a good glycemic load in proteins that I can talk to you about those more. If you're interested, just text me or email me. I can go over what are those number means and how we can choose our protein based off that. Have your protein outweighs your carb. You know, maybe that was a time in your life that you were eat more carbs than protein less, you know, when you do the portion for your plate. But this is the time that your protein should outweigh your carbs. And, you know, there's one point here. At nighttime, do not remove your carb. Aim for a good resistance starch and carb. What it does, you know, don't worry, you don't get weight. It's not gonna go in a fatty form, fatty cells for you. What happens when you have good carbs at night combined with the protein and your vegetable? It will increase your insulin level a little bit. That increase will decrease the cortisol level. That makes you to go to better sleeps. You know, that gives you a sleep through the night point. If you have enough carb at night, that helps for the conversion of T4 to T3, which is your thyroid active form of hormone. And, you know, all those things happen when you're good for a good complex carb at night. Again, overall suggestion, what to do. You know, I talk about digestion tract, GI tract like a tube from your mouth to the end. So what happens, what is important for perimenopause is a start from your mouth, oral care. If you haven't been in your dentist or doctor, go and make a visit. Whatever happens in your gum, in your teeth, you know, all those bacteria, you're swallowing it gonna affect, because microbiome is not only in your intestine, it starts everywhere. It's in your mouth, it's on your eye, your ear, your skin. They all have microbiome, their own microbiome. So whatever happening in your mouth, whatever happens for your tooth and teeth, it's gonna affect directly your organs and your microbiome and your hormones. So oral care is very important. The other things, remember we talk about leaky gut in our GI tract. So chew your meal. If you're someone that, you know, you feel, oh my God, I get bloated or gassy right away after I eat, you probably need to chew more your food. And, you know, it is important because when you swallow and, you know, in your stomach, there are enzymes that helps to break down the food. But if and then it goes to the intestine to get more breakdown and absorption. But if we have large chunks and we have leaky gut, then, you know, remember the fence and the gate, and you know that that gate is open so the chunks can go out, the things that we don't want to go. Chew your food. Sometimes with aging, sometimes with stress, sometimes different side effect of medication, our stomach acid is low, and that digestion, that enzymes, we don't have enough of those. Maybe that's your case, that in those cases you can get help from additional enzyme. It could be in the form of supplementation like enzymes, or, you know, sometimes apple cider vinegar before your food, or lemon juice. But if you have ulcer, if you have something like that, don't do that, please. Talk to your practitioner and, you know, see what is the best way for you to get help. If you are low in stomach acid, if you are someone dealing with acid reflux, you probably have low stomach acid. Food diversity is very important. I talk about protein, but now I want to tell you, please have a diversity. By research, we don't know exactly what diversity means, like how often, what kind. But if you're eating chicken, beef, maybe bring turkey. Maybe bring, I don't know, some sort of sausage form. If you eat beef, add turkey, add chicken, add thigh, add wings, you know, just rotate them. Maybe another diversity could be, you know, do a high protein for 2 days, do a high carb for 2 days, do intermittent fasting for 2 days. Just bring new things, you know, our microbiome needs diversity in quantity and quality. not only, you know, just the volume, we need different species in our microbiome. We need to introduce different way of eating, different proteins, and, you know, all different nutrition. Keep that in mind. Probiotic, prebiotic, postbiotic. Probiotic, we all know those are the good bacteria, and, you know, we can either have it through the food, which I love, like all those fermented food, kefir, like a yogurt, the good real yogurt, whatever that, you know, kimchi, sauerkraut, all those good probiotic food. Prebiotics are the food for probiotics, usually fibers, resistance fibers, water soluble, non-water soluble, all those things. Those are good fibers. Postbiotics, actually, those are like probiotics that, you know, that turn to the postbiotics. And I'm not going to go in detail. The only thing that I want to mention here, there are researchers behind this that showing the postbiotics. They're working in different area of our intestine. Some of them are short chain fatty acid. One of them is butyrate. That is very anti-inflammatory. So these are the things that we need, and it's actually helping with the hormone production, hormone balance, and things like that. Keep in mind, we need a good variety of these things. We need a good variety of resistance fiber. Resistant fiber, you can easily turn, you know, sweet potato or white potato, cook it, let it cool. The starch turn to resistant starch, and that's beneficial. It means that it will go to your large intestine, not the small intestine. It will help the large intestine. It goes for so many different areas. Alcohol, if you are someone in your perimenopause, and when you're drinking alcohol and you see, oh my God, I don't feel the same as before. I get rosacea. I feel bloated. I can't tolerate. Yes, this is the time that you need to consider eliminating or reducing it, because we see so many different evidence that when we go to perimenopause, that hormone fluctuation and alcohol, they don't go together, and alcohol negatively modulates microbiome and create inflammation. Any questions so far? Anything? I see some of the chat things here. Let me see what we have. And then, does protein outline the metabolic balance diet meet the guideline of one? Okay, the very good question, Jean. Hi, Jean. Jean is in my metabolic balance program. Not exactly. So that's something that I can talk to you. After this, or if you want to talk later on in the group, that's something that I can address besides this, because that's going to take long. No, that metabolic balance is not a very high protein diet, but it's a complete balanced meal. That's a good one. Ramesh, thank you so much. I need to, okay, sure. Okay, I'm gonna go back. I'm almost done. Couple of more, and then let me share again. Okay. So what we have so far, so we know that we have hormone imbalances, fluctuation through perimenopause. We know that estrogen, progesterone gonna go down. We know that we can help go through that with ease with taking care of our gut microbiome and exercise, lifestyle, meditation. And sometimes actually hormone replacement therapy is the key. But the thing is, like, the hormone replacement therapy by itself alone cannot remove anything. All those things that I said by themselves alone cannot. So if you are a candidate for hormone replacement therapy, it can be a very good boost for, you know, going through the perimenopause and menopause. Sometimes, you know, some people, they're not a candidate, and sometimes it's too soon, but, you know, definitely that is something that you want to consider as well. But these are all should be together. These are not, I only do HRT and bioidentical, by the way, body identical. I only do that one and I'm good. No, you have to go through the stress management, gut microbiome, and all those things. the one thing that I want to mention here, you know, when we go through that hormone fluctuation, birth control, or, you know, at the beginning, we talk about the mood roller coaster, the mood swings. You know, I've seen so many friends, families, and clients, they're going through depression, they're going through anxiety, and that is a sign of perimenopause and menopause, and is only can be helped through whatever we talk about. But the solution is, okay, take this antidepressant. I have a friend that's dealing with that, and with a high glucose blood sugar, and she's taking so many medication, but the solution is something else. So what I want to say, the birth control, the antidepressant, there aren't true menopause cure. There are like a band-aids. So some people, because of the heavy bleeding, remember I talked about low estrogen, progesterone, that they can cause like different things. One of them was heavy bleeding. Some people go through IUD and, you know, different even surgical things. They're not really addressing the root cause. Sometimes going out of your physician office, it can be the answer, you know, is just approaching different holistic wise approach to the problem can be the answer. So what you need, you can absolutely enjoy a smooth, balanced transition through peri to menopause. And what you need is structure, accountability, and plan. And I would be honored to support you on your journey through this. That is what I'm really passionate to do, and I have the means to do with all those functional testing and what we talk about. Okay, so if you have any questions, let me know. You can unmute yourself. You can ask me or Ozzy the questions. Otherwise, I'm going to let you know that these are the giveaways, the lab testing guides, and the gut balance PDF focusing on key hormones. Please have them as a reference. Those are very nice put together documents. What we offer, Azadeh and myself, we both have half an hour complimentary consultation. Take advantage of that. I put the links in the chat if you want to book it or, you know, save it for later. They're all there. Our next webinar is about rediscover yourself. Do not miss that. It's going to be very amazing. And it's next Wednesday, 12 to 1. And again, thank you so much for staying with us today. And you guys are amazing and a very nice audience, and we appreciate that one. Any feedback, any questions is appreciated. Let us know either now or later. Okay. I'm gonna stop. And I'm gonna stop the